Hi everyone, I'm Theruni.
I'm Sujan.
And we're from the Physio. And today we're going to show you some self-release techniques that you can do at home by yourself to help reduce some of your neck, possibly arm or shoulder pain. This ties in really nicely with our previous video which showed some simple exercises to do for stiff necks and shoulders. So self-release is basically massaging through some tight areas by yourself to reduce your pain. Today we're going to use a ball, so you can use a rubber ball, a tennis ball, maybe a spiky massage ball if you have one, and all you need is a ball and a wall, and you can get started. So the first muscle we're going to show you to release is the pectoralis muscle, which lies at the front of your shoulder here. This tends to get very tight in a lot of people because we tend to round our shoulders, especially if we're on laptops or computers for long hours, maybe we drive for long periods. When it gets tight, it pulls the shoulders even further forward and it strains or tightens up our neck muscles. So the first technique here, we basically need to place our bodies in front of the wall at the corner, so your opposite leg can actually go further forward in front of the wall, and place the ball on your pectoralis muscle, so just underneath your shoulder. You'll be able to find a few tender points probably at the front by first just palpating or touching across there and figuring out where the tender points are, and then placing it there in that tender point, and then placing your arm in this position above around your shoulder level. And what you want to do is just basically press deep into the muscle belly by pushing your body weight forward onto the wall and maybe holding for about 10 to 20 seconds on each of those tender points. You can also go across the muscle fibers, so just transfer the body weight across, or you can also just gently go up and down the muscle as well by bending at the knees a little. If this position is too hard to maintain or it's difficult to get into, just place your arm by your side and let the arm relax completely, and you can do the same thing. Perfect. Okay, so let's move on to the second area, which is basically between your thoracic spine here and your shoulder blade here. You've got some muscles that here between your shoulder blade and spine that can get very tight, and when they do, they can send the pain or refer the pain up to the shoulder, up to the neck, maybe even bring on headaches or arm pain. So we're going to place the ball on the wall, and again we can either press directly into the ball, or we can go across the muscle fibers in this direction, or go across this way, up and down in this direction. So Sujan, you're going to come across and get into a small spot position, place the ball between your shoulder blade and your spine, and then find out where your trigger points and knotty points are, and then work your way into those areas. So you might work on each spot for about 10 to 20 seconds as before, and then just gently release it. So at the beginning, go gently. You don't want to bruise your skin or cause further pain. As it starts to release, as it starts to relax, you'll be able to go deeper into the muscle and maybe hold for longer. Don't be worried if you can feel the pain radiating into different directions, maybe the arm or head. That's fairly normal. Just take it easy at the beginning. The third area that we're going to show you is at the back of the shoulder here. So your posterior cuff muscles here, which lie directly over your scapula or your shoulder blade, they can get very tight. And these points tend to refer pain to the front of your arm or shoulder, even down the back of the arm into the elbow or around the forearm and wrist. So it's basically, again, you find your points along here. We can go directly in, across, or up and down. And it's the same position as before, into a slight squat, a slight bent, knee bent position, and we can roll around there, releasing again. Yeah. Which technique do you find the best?
I think it's going across.
Across, yeah. That cross friction across the muscle belly works really well. Okay, so I hope today's video gave you some insight into how you can help reduce some of your pain on your own, and I hope it's helpful, and maybe you can share it amongst your friends,
And like our Facebook page.
And don't forget to like our Facebook page. Thanks for watching.
Thank you.